A baby's head is relatively large and heavy, and is about 25% of the baby's total body weight. Their neck muscles are usually too weak to support their large head. If a baby or toddler is violently shaken, it takes only a few seconds to do irreversible damage to their brain or other areas of their body. An infant's brain is immature and more easily injured by shaking. The blood vessels around a baby's brain are more vulnerable to tearing, and a baby's small size also increases their risk of injury. During sudden and vigorous shaking, an infant's brain rotates and pitches in different directions within the skull cavity, which can cause a diffuse axonal injury, or DAI. This is an injury that can damage or destroy brain tissue. Blood vessels that feed the brain are torn, and this causes bleeding around the brain. Blood then pools in the skull and sometimes creates pressure and additional brain damage. Retinal bleeding in the lining of the eye is common and can lead to poor vision or even blindness. The force of shaking a child violently is much greater than if the child were to simply trip and fall. In cases of SBS, that force is repeated as the child continues to be shaken. Shaken baby syndrome can have disastrous long-term consequences. Some of these consequences may take years to develop, including a wide range of physical disabilities and behavioral disorders. Shaking a baby in anger or frustration is never the answer. Help is readily available for anyone who's at risk for harming a child. If a child is in immediate danger due to abuse or neglect, 911 should be contacted. Also, most states have a child abuse hotline, or the National Child Abuse Hotline can be contacted toll-free at 800-4-A-CHILD or 800-422-4453.